you're talking about the SMP and the hairlines being created too low, that is a common problem. And I think it's often the practitioner may be enforcing their own opinions on patients rather than asking the patients. But I've dealt with many patients over the years who've had a hair transplant and they're saying it's too low, and then they say, well, okay, well, who designed that? And it's actually, well, I asked for that. But actually, in reality, when they see it grow free and they see what it looks like, they don't like it, and then they actually want to then fix the issue.
There's a massive point there. I certainly used to be a bit of a people pleaser. When I lacked the experience, I wanted to make the person in front of me happy, and I had this false belief that me doing what they asked of me would make them happy. What they don't really want what they're asking for a lot of the time. They have an underlying problem or belief system that is why they're there in the first place, and they really want your expertise to help draw that out and address that issue. Just giving them what they want, as you say, often results in them being unhappy, and you've got to give them the perspective of your expertise to be able to actually solve their problem. And if you get that right, then it's powerful stuff, because often the most gratifying thing in the world is when a patient comes back and says, you know what, you're absolutely right about that. I did ask for this, but I completely see why now that going that low would have been a mistake. I really like what you've done, and I'm so glad that I didn't just go to a yes man that did what I asked.